Hi, listeners. Thank you so much for joining for this next episode from the Lessons from the Playroom podcast. I have with me a returned guest to talk about a topic that shockingly we have not talked about on this entire podcast series, which is crazy because we're talking about working with the family system. What? I know it's kind of crazy. So I have with me Dr. Stacy Jagger, who I'll introduce here in a minute. And we're gonna just dive into all things family, therapeutic approach with
Yeah.
family, how to support the family in the process. For those of you that do not know Dr. Stacy Jagger, we did record a previous episode that was specifically talking about how basically the use of technology and how technology impacts families. And we introduced a concept that Stacy is quite known for called the 30-day blackout. So I'm going to put that on your radar, everyone, to go back and have a listen to that particular episode. If you are not familiar with Dr. Stacy Jagger, here's a little intro. The first thing is that, yes, her name is Stacy Jagger, but she's actually known as Dr. Sassy. She's Dr. Sassy. Uh, and Dr. Sassy is on a mission to heal disconnection in children and families. She's the founder and clinical director of Music City Family Therapy, creator of the Mountain Method, therapeutic protocol, author of the 30-day blackout. She's often praised for her connection-based, rapid results approach to relational and family challenges, which, listeners, is precisely why I asked her to be the guest for this topic. Her ability to connect to the child within and boldly speak hard truths with heart-centered humor has earned her the nickname, yes, Dr. Sassy. She also founded the Advocate for a Creative Child, a nonprofit organization that underwrites mental health care for underprivileged children and is building creative playhouses in underserved communities in her hometown of Nashville, Tennessee. Amazing, amazing, amazing. She and her hubby, holistic naturopath Ron Jagger, who, by the way, is also amazing, are the proud parents of four. I will also say four amazing because I've met them. Four amazing children. In her free time, she can usually be found exploring the natural world, playing music with her children, or enjoying her lifelong love of ballroom dancing. Hi, Doctors Sassy, Stacy.
Hey, Lisa. Hey. It's so good to hang out with you. Truly.
It's lovely hanging out with you. I always have
Yeah.
fun talking to you.
Yeah.
So Stacy, so there's this thing in the play therapy world that I'm just gonna name,
Yeah.
which is that for a lot of play therapists, when we first do our training, the training is heavily focused on understanding the child and
Mm-hmm.
working even really just sort of one-on-one with the child. I think that's true for a lot of play therapists, not every play therapist. And
Uh-huh.
then from there, there is typically then extended training to involve the parents and maybe work with the parent-child dyad a bit more.
Mm-hmm. Mm-hmm.
Um, but to really think about the family as the
Mm-hmm.
client is,
Uh-huh.
I would say, is not the common thought in the world
Yeah.
of play therapy. It's the
Mm-hmm.
child's the client,
Mm-hmm.
but not the family. And I know you come at it from a completely different
Mm-hmm.
approach.
Mm-hmm.
And so let's talk families.
Yeah. Absolutely. Where do you want me to begin? I love
Well,
this conversation already.
yeah, well, let's just talk about where did you or why did you gravitate towards family as the primary versus just like one-on-one work with a child?
Yeah. Sure. Okay. So, first of all, Nashville is my hometown. And I'm 50 years old. When I was 10 years old, I desperately needed help for my own self and my own family. To my knowledge, there was no child and family therapist to be found in Nashville, Tennessee. And so a lot of my work is very informed by the child inside of me. When I decided to go back to graduate school, launched my private practice. I was in community mental health before that. I noticed this, that it was very child centered, which was great, but my own story informed this desire to want to work with the whole family on the child's behalf.
Mhm.
And I was honestly shocked after I got out of graduate school that I really couldn't find anybody to mentor me. And well, okay, great. I'm ready to work. And how do I do this?
Mhm.
And what ended up happening is I sort of pieced together a framework that I call the mountain method, for the purpose of working with the whole family system. So really, Lisa, from the beginning, I get so many calls for children, but in my paperwork, the child is the client.
Mhm.
But I expressed to the parents from the beginning that I will be working with the whole family on the child's behalf, because my training was brilliant in family systems from the beginning. And then I just sort of uh, put the play therapy techniques in that systemic framework,
Mhm.
but I really didn't have a practical way to do that. So I just kind of took a shovel and an axe and figured it out myself.
Mhm.
Primarily because, Lisa, I really believe that children can't change unless the parents change. And I really do believe this. And farming everybody out to different therapists isn't always practical. Like, there are many families that just want to see one person to walk their family through a process of transformation and healing in a time efficient way, where I have the flashlight, I've climbed this mountain myself, I can tell you how to do this, I've done it too. I can't do the work for you, but I know the way. If you want me to show you the way, I can. And so I will continue to do my own work with my own family. I was raised in a very violent alcoholic family, was evicted 15 times by the time I left home at 16 years old. In many ways, I didn't even start parenting myself until I was legally an adult. And so when I became a mother myself, I knew that if I did not continue to do my own work, that I would not be able to show up for my children in the way that I wanted to. So this has really become a lifestyle for me, to be perfectly honest. And my supervisees and interns that work with me, I let them know on the front end that, my caseload is spilling over, and I want people that I trust, that I can teach and train to work in the way that I do. And so they have, and I will say that being a family therapist in the way that I practice is like an artist backed by science. And
Mhm.
so I truly have turned family therapy into an art form,
Yeah.
and in raising up other therapists that want to be artists in that same fashion, if that kind of translates to your question.
Yeah, it totally does. I have a question here before I get into the sort of conceptualization of the
Yeah.
process.
Okay.
Um, I think for a lot of play therapists, when they go, "Oh yeah, I do family work," what they're really saying is, "I do parent-child dyadic work."
Hmm.
When you work with the family, do you also work with the siblings? Like, is it the whole
Hmm.
system or is it
Hmm.
just the parent and the child?
So that I don't overwhelm your audience, let me be clear that session one is a parent consultation. Session two is a parent child play based assessment. Session three is with the other parent. Session four, I'm doing a parent consultation. Session five, I do a check in and do, work with a child with child centered play therapy. So the first 6 sessions or so is a lot of assessment, joining, all of that.
Mhm.
But at that point, after around session 5 or 6, I have the creativity to work with the subsets of the family system that I find is necessary to massage the system to help them all climb the mountain that they have named that they want to climb. And in the beginning, the parents are very clear. This is where we are at the bottom of the mountain. This is what we want at the top. And when I'm doing check-ins with the parent, they will say to me, I think we're 30% there. I think we're 50% there. And that is how I'm able to monitor their progress. I typically work with the child and family weekly till we're halfway up the mountain, then every other week, then once a month, and then we pick a graduation date and we celebrate at the end.
Mhm.
But what I'm trying to convey is that please don't think that I have the entire family system in my office day one, because I do not. What I am doing though is I'm looking at the whole family system from the beginning, with the family being the client, and
Mhm.
working with everyone. And then you know, towards the 50-70% mark is when I do have the whole family in my office and I'm
Yeah.
working with the whole system. But you
Yeah.
kind of have to massage it as you go, because you
Mhm.
don't want 6 dysregulated nervous systems in your office all at once from day one. So there's kind of a method to my madness, is what I'm trying to communicate.
Well, as you're talking, I'm like, oh, so you're a holistic therapist, is what you are. Is you're coming in and you're gathering all the information
Mhm.
from multiple angles to try to
Yes.
really get a sense of what's going on, not just from one perspective, but from many perspectives.
Yep.
And from all that information gathering, then you're kind of putting together your treatment idea.
Uh-huh.
A treatment idea can involve whoever it needs to involve for
Mhm.
the goal that has been set for this particular family. So maybe it's sibling work, maybe it isn't. Maybe it's one
Yep.
parent, maybe it's both parents,
Yep.
maybe it's
Yep.
everybody, maybe it's just
Exactly.
it. And it's really, so I'm hearing a very holistic
Yep.
approach
Uh-huh.
to be able
Yeah.
to get from here to there. Is that accurate?
Yeah, I mean, after the assessment time, there have been times that I've thought, the child isn't the problem here. And I might work with just the dad for a little while. Or I might decide that, I need to work with the parents for just a little bit. And there's other times that I really do need to work with just the child for a little bit. But truly, I have the whole family system in my head from the very beginning to conceptualize where they are and what they want. And I just climb the mountain with them.
Mhm. Okay. Can I start asking you a bunch of questions?
You can, you can.
So exciting. Okay, so what do you do if at the very beginning you run into a family system that isn't interested in being part of the whole process? Because I think sometimes that happens, right? The parents bring the child and it's like, no, I don't really think we all need to be involved, or I don't really think we need to be involved at the level that maybe you're proposing. So how do you work with when the
Yeah.
system doesn't want to shift and doesn't want to get in there and do the work?
Oh gosh, Lisa, you know what? It depends on the family, but I'm kind of a hard ass, if I'm honest with you.
Yes.
And there let me give you a few different answers to that question. You have
Yep.
different options. One is you work with the most motivated pieces of the system in the beginning, which creates more willingness on other family members. Okay. In a divorce scenario, I might work with just one parent and not the other side of the story for just a little bit. When the other parent starts to see the movement happen and hope is raised, many times the other parent is willing to engage. But I have to be honest with you that I'm kind of a hard ass from the very beginning, and I'm very clear about how I practice. If you want me to help your child, this is how I do things. And
Yeah.
so I kind of win the battle for structure from the very beginning, with some exceptions. I used to be pretty inflexible, if I'm honest. 10 years ago, I was pretty inflexible. I've learned to be more flexible because a lot of things will come out in the wash after a while if you just trust the process and kind of massage things and do your artist, I don't know if I'm making sense to you, but
Completely. Completely.
there's willingness that and hope that rises over time, and
Yes.
parents become willing to do things that they were not willing to do before, especially if you can wrap your head around this idea of perturbing the whole system on purpose.
Mhm.
And I'm the bad guy many times. I will tell parents there's nothing like a common enemy to bring a family together. So I have no problem being the bad guy for a little while. But you do have options. I think, Lisa, what I've found is that, I did not know this in the beginning, but working with a whole family is like twice the energy, twice the scheduling. There's a lot of you're holding a lot of space for a lot of people. And I don't know why exactly I've been so willing to work this hard for so long. But I think if I can boil it all the way down, I just wish someone had done this for me when I was a child. And that's really what it boils down to. I just wish somebody had come along and said, "Hey, guess what, little Stacy? They think you're the problem, but you're really the hero. And I'm not only are by you getting help, not only are you going to get help, but your whole family is going to get some help in a reasonable amount of time." And my treatment time is usually 3 to 6 months from the beginning to the end. Now, certainly it can take longer and sometimes shorter, but I find that families have about that much bandwidth, to do the work. And I am, doing lots of reparenting work with the parents while I'm working with the child and integrating siblings. And I have a little sign in my office that says Cherry Tree Lane, because I do feel like Mary Poppins on my little umbrella, and I come down and I assess the situation, and I'm super creative with the whole family. And then, but I don't know if you saw Mary Poppins 2, but I cried like a baby through the whole movie, because she always had this little look in her eyes of when it was time. Like she knew it was about to be time for her to go. And it was time for her to get her little umbrella and fly up back in the air and go wherever Mary went.
Yeah.
So I do have a sign that says Cherry Tree Lane in my office for that reason.
So beautiful. Okay, so the word artist has come up a couple times.
Yeah.
I know what you mean because I know you, and you are very much an artist on many levels. And I know that artist doesn't necessarily mean pull out, something and draw or paint.
Uh-huh.
Um, but let's talk about art. Like, let's talk about artist in the
Mm-hmm.
context of being the artist therapist and
Mm-hmm.
the creative process of working with families. So
Yeah.
what does that mean? Like, what
Early in my career, I had a conversation with Eliana Gill that I will never forget.
Mhm.
And she explained to me that many therapists are doing therapy out of a book or out of a box. And she really gave me permission to think about, what if you were creative enough to not have to do it that way? And it kind of gave me permission, really, to just be myself. And in my early 20s, I was a dance teacher. I was a music teacher. My background is in the performing arts, and so I already had that mindset of creativity and making my own way and creating my own way of doing things. Quite honestly, I don't follow the rules very easily. I'm just being real honest. I kind of have to do it that way for me to feel like I'm being myself. But when I say, as a therapist, being an artist backed by science, it's really giving yourself the permission to think outside the box, to let it not be linear, to take a side door, back door, go through the roof.
Chimney. You're coming
Yeah,
down.
go through the chimney. Like, the front door's not working. We're going through the chimney this time. It's saying things that you may not think are appropriate, but you're creating little micro changes in the whole system based on the things that you choose to say or do. Um, and it honestly, for me, it makes my job fun. I don't ever get bored, because I don't have to follow a linear thing, and quite honestly, I think working with whole family systems, you almost have to think like an artist, because there's so many different personalities, so many different views, so many perspectives, um, and their perception of their relationships with each other. So there's commonalities to, like, I am kind of a rinse and repeat in one sense, but the framework that I've created gives me a whole lot of freedom. And quite honestly, Lisa, my book, 30 Day Blackout, this just happens to sit here with me, it would not have the nervous system stuff in it had I not met you. So a lot of the synergetic principles that I implement came from my training with you. And I think that legitimizes my practice really, because people know that I work this way. But then when they want to know the science backed by it, I can give it to them, if that
Yeah,
makes sense.
totally. Well, we're talking about a creative process, which is so right brain.
Mm-hmm.
And to
Yeah.
be able to, yeah, bring in the left brain, this is why that works is super helpful. So Stacy, what I'm hearing you say is really a lot of sort of organic sort of
Mm-hmm.
organic creativity.
Yeah.
Let yourself be in sort of flow, in rhythm with
Yeah.
family, with what's
Yeah.
needed, to
Mm-hmm.
throw the script out the window if it
Yeah.
needs whatever, to change up the protocol, to
Mm-hmm.
redo that. Maybe you learned this little take, we'll read it, flip it around, start from the end and work backwards, like whatever it is,
Yeah.
which is really this sort of, how do I work with what needs to be worked with in the way that it needs to be worked with, rather than
Mm-hmm.
holding on to something. What really strikes me with what you're saying, first of all, of course, I love that so much of this is you're being authentic and true to yourself, because
Yeah.
that's part of the magic of you in the playroom. Um, Talk about a deep level of trust for the therapist to have within themselves. Like,
Mm-hmm.
really, and the reason I'm bringing this up is because I feel, Stacy, like the field has inadvertently disconnected play therapists from their own intuitive knowing,
Mm-hmm.
as the field has swung so much towards there is a way and there is a
Mm-hmm.
protocol and there are the steps and there are these things. And
Yeah.
so if I'm following what I think I'm
Mm-hmm.
supposed to do, or I'm doing it the way that I've been told I have to do it, how do I trust myself to know when,
Mm-hmm.
where, how to adapt, all of that. And so I'm kind of hearing a little, also a bit of a call to action for play therapists of,
Mm-hmm.
put all the ideas in your Mary Poppins bag.
Your carpet bag.
You got your carpet bag. Take all your training, all your books,
Yeah.
everything you've ever learned, shove it in that bag.
Yeah.
Walk into that room, and then
Cherry Tree Lane.
you look in that bag and you decide which thing that you want to pull out on
That's
that
exactly right.
on that particular
Exactly
day.
right.
And you're the one that gets to decide.
Yeah.
Does that resonate?
Yeah. Lisa, with the students that I'm working with, I tell them this a lot because they they look up to me. I've accomplished a lot in a very short amount of time here in my little microcosm of the world. And I recognize that they can put me on a pedestal that I don't really want to be on, to be perfectly honest with you. And I will kind of, they will ask me 7,000 questions and I'll answer them. But what I want more than anything is for them to own it for themselves
Yeah.
and with who they are and their perspective and their creativity and their story and why they chose to become, a healer. And so I agree with you. I think I'm a little bit of a rebel, or a lot of bit of a rebel, in a good way. In that I think from the beginning of me becoming a play therapist, I would go to the conferences and feel a little bit like a unicorn, because family therapists, quite honestly, are very underrepresented in the field of play therapy, or that's my perception. So I don't know that true systemic training is on the forefront of the play therapy field. But having said all of that, um, there's nothing more important than you showing up as you.
Mhm.
There just there just isn't, because you're modeling to your client that it's okay for them to be them.
Yeah.
And if all we do is sit here and breathe, and
Mhm.
that's all we do, and that's the message that I'm giving, then I'm doing my job. I have the ability and the freedom to do a whole lot of fun things, because I'm in private practice, and it's,
Yeah. Well, so
what it is. Yeah.
let's talk about this because there might be listeners that are that think maybe they have a judgment on themselves around, but I'm not a very creative person, or
Mhm.
I'm not a dancer, or I don't
Mhm.
play music, or I don't like that's just, and so maybe there's a listener right now that's listening going, well, I don't know what this would even look like for myself because I don't know what that even means. And Stacy, you feel free to add to this or disagree or agree or whatever it is. But I believe that everybody fundamentally is creative and
Mhm.
everybody is an artist. And it doesn't have
Mhm.
to look like dance or art or music or
Mhm.
whatever it is. And so the message really is what's your form?
Mhm.
What's your form
Mhm.
of creativity in the playroom?
Mhm.
Maybe you rock it in the sand tray and you
Mhm.
love sand tray and you get super creative with sand tray. Maybe
Mhm.
you rock it with puppets and you're like,
Yeah.
I got so many voices. Puppets.
Ah,
Or you rock it with the dress up, or you
I have to tell you this. So Paris Goodyear Brown was my supervisor for 3.5 years, and she has a drama background, and so I'd be in supervision with her. I'd be like, "Dang, girl, you got the puppets down." She
you
was
get the
she
like
was
the
rocking
exactly
those puppets.
right.
Yes, yes, absolutely.
And so, like, we all, I think, need to own our form of artistry in the playroom and our form. Maybe someone's form of artistry is bibliotherapy. And
Mm-hmm.
oh my gosh, their knowledge about books and
Uh-huh.
talking about
Uh-huh.
characters in a book. And you're sitting there next to someone reading, and you're like, yes, that's artistry. And so,
Mm-hmm.
can we give a message to listeners who maybe go, gosh, I don't know if my form of creativity is the way that Stacy's form of creativity is.
Mm-hmm. Mm-hmm.
Let's talk about that.
What comes up for me is that every child is an artist.
Hmm.
And if you get in touch with a child inside of yourself
Hmm.
and let her out of the cage and
Hmm.
let her be free and let her have a voice and let her make mistakes
Hmm.
and let her be messy,
Hmm.
that, and you don't overthink it,
Hmm.
that, and you can learn to trust that voice.
Hmm.
I think we can all agree that we all have that part in us.
Hmm.
Maybe when you went to kindergarten and they told you to color inside the lines, that part of you started to die a little bit. But if you can go back and remember when you were an artist and go back and reclaim that part of yourself as a therapist and bring that part of yourself into the playroom,
Yeah.
there's a freedom that comes over you when you do that. When I was a little girl, my mother's had her kitchen, and right next to it was this little corner that had a Holly Hobby record player and a Donnie and Marie Osmond microphone set and a little organ. And I would play Parton records, and my mom was very well endowed. So I would put these little stuffed animals in her bras, and I would just sing, and and created like a world of my own because I was raised in so much challenge. That's kind of how I survived it. And I call it La La Land. But if you can go back to your own La La Land and let it be okay, and what a privilege that you can bring that La La Land, that part of you, into the playroom in your work.
Hmm.
I really feel like creativity is a mitigator for burnout. It has been for me. I see a lot of families, but my creativity allows my burnout. When I feel that burnout, it brings me joy. It brings me life. If you'll, if you'll, my mothering with my children, that is what has allowed me to not be burned out as a mother as well. Is that creative life force inside of me. So you talked about flow. I think you're right. I think everybody can find their own flow. And whatever that means to you, you get to define it for yourself. But to leave that part of yourself out, I think you're doing yourself a disservice. And if you can kind of go back and reclaim what I call la la land and let that be, give it permission to be with you today, that you may find that it is a mitigator for burnout, and compassion fatigue and all the things that we will all eventually struggle with on some level.
I'm smiling and laughing inside because I wrote an article years ago called "How John Bon Jovi Helped Me Become a Play Therapist."
I read it. I know exactly what you're talking about.
So,
It's so good. So
well,
good.
it's funny because I I think from a just from an objective point of view, I don't think people would pay to hear me sing in concert. Just say,
Come on.
just from an objective point of view, right? But I spent so many hours standing on my little twin bed with all my stuffed animals on the floor,
Yeah,
surrounded.
girl.
I mean, I
Yeah, girl.
rocked it out to all my stuffed animals, right?
Air,
But
air solos.
oh, the
Oh,
whole
girl.
thing.
You
Take it,
took
Rick
it all the
and Laura.
way.
Yeah, take it, right? Take it home. Right? Totally. But but just the feeling of freedom in that
Mhm.
is the part that I can bring into the playroom, right? The just the part that wants to express
Mhm. Mhm.
and yeah. So anyway, I was just laughing. I'm like, yeah,
Yeah, and
I,
then you're giving your child client the permission to be happy, joyous, and free. And that's
totally,
what,
exactly,
when they're happy,
exactly.
joyous, and free, they don't need you anymore. So
Yeah,
it's okay to expedite this thing and let it, I tell people, Dr. Sassy,
Dr.
at the end of the day, her message is we're all gonna be all right. Like
Yeah,
we're gonna be all right,
yeah.
you know.
Mhm.
And
Love it.
and Lisa, you've done that for me. You do that for this whole field. I have a lot of appreciation for the gifts that you've given.
Mm.
Not to turn it on you. I know you're interviewing me, but anyway.
Well, thank you. Thank you. Well, I'm gonna turn it back here for a moment.
Go ahead. Go ahead.
Yeah, as we circle back around, I think the big message here that I'm taking, and I hope the listeners are taking too, is just a relook or a rethink at the client being just the child
Mm-hmm.
and real permission to look at the client as the entire family system
Mm-hmm.
and to maybe look at it from a more sort of organic way and what's
Mm-hmm.
actually needed, not how we're
Mm-hmm.
supposed to do it, but what's
Mm-hmm.
actually needed.
Mm-hmm.
And then and I think for a lot of play therapists, and then what are the fears or what's in the way of doing that, because I think there's a lot of fears that come up for a lot of play therapists and sort of stepping into that. And so I'm just appreciating this conversation as a reminder um to play with the family, like the
Mm-hmm.
whole family, not
Mm-hmm.
just not just the child.
When I'm working with parents and I realize that they don't want to play, they don't like to play, they're kind of triggered by the thought of having to play. I am able to have conversations with them about their own relationship with the child part of themselves. And it can be very painful for a parent to play if no one played with them or interacted or connected with them. And so I really pushed up against this idea that children can change without the parents changing and doing their own work from the beginning. Like I just didn't buy it, if I'm honest with you. And so um I I kind of feel like a unicorn a little bit. And I just want to give whoever's listening permission to, when you're working with a parent, you are advocating for the child. When you're working with a parent and helping them learn to play, you are advocating for your child client. Because when they go home and that parent is able to bypass their resistance of not wanting to interact with their own child, and they call you and say, "We're playing Uno and we're playing da 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 da," and we're what you've done is you have enabled and empowered a parent to become the change agent for their own child rather than you carrying all the weight of doing that yourself. And I yeah, that's what I have to say about it.
Yeah, amazing.
Yeah.
So I want to, as a wrap up piece here, you mentioned the mountain method, and you even gave a little
Mhm.
of the metaphor going through here. I know that you do trainings, and
I
so
do.
if there are therapists that want to learn how to work in this way that you're describing,
Mhm.
or even
Mhm.
want to spend time exploring their own inner artist and creativity, because I know that you do that as well.
Mhm.
Um,
Yeah.
let's where can they find more information,
Sure.
learn more?
So if you go to drsassy.com, everything you never wanted to know about me is all right there. And if you go to themountainmethod.com, my course will launch in 2025 where any family, any therapist, quite honestly, I think the Mountain Method course is a great addition to what therapists are doing currently without you having to figure it out. Like the course could really walk you through how to do this on your own, and you can just kind of take what you like and leave the rest. And then if you want to reach out to me directly, you just go to musiccityfamilytherapy.com, and that's my practice here in Nashville.
Amazing, amazing, amazing. So Stacy, any last words for our listeners when just around working with families?
Yeah, Lisa, there was one thing that came to me I wanted to bring up. My perception of why therapists are not able to work in this way is when they're dealing with insurance. Like,
Mm,
that's the only thing I can think of that would prevent them from being able to code it the right way. And that makes me so deeply sad if I'm just honest. And I don't really know how to even have this conversation with you, but I think a big reason why I've been able to have the freedom to work in the way that I do is because I'm a private practice, cash and carry, and not everybody has the freedom to do that. And it just makes me sad, that there's so many therapists entering the field that want to be able to work with people's insurance, which is heroic in my opinion. I don't know that they are able to work with the family, or the code that they code is, I think the insurance reimbursement is significantly lower than when they're just seeing the child. So there's some other factors I think that kind of work against some people that are in the field. And that's a big, I've just opened up a can. Sorry. That was a big old
no.
can I just opened up, but
Well, for some people, you might have just named their reality, and so just
mhm.
good to name it, and then yeah, how do we think through that? How do we get creative with that? How do we advocate for change around
Yeah.
that? How do
Yeah.
we advocate to educate systems for understanding
Mhm.
the significance of working with families? So, I mean, it's good to name
And
it.
that may be a way for a family to go through the Mountain Method course at home while the child is seeing
Mhm.
a therapist in their local area. I'm just kind of brainstorming out loud, but
Yeah,
yeah.
yeah.
Last thoughts are, I am grateful for this field. I'm grateful that I'm a part of something where, I realize that we all deeply care about children and have different ways of working with them. I'm grateful to have it's such a small community. I don't think I realized when I went into this field that it's just a very small club. Um, and this is the hill that I'm going to die on. I know that it is. um, and so I'm just thankful to be a part of it. And I love knowing you, Lisa, and the work that you've done all over the world. You've been very inspirational to me. So thank you for letting me talk about families with Dr. Sassy.
You blipped out there for a second.
What did you not hear?
So we'll edit that part. So go back to start with thankful for being in the field.
What I was saying was I'm deeply grateful for being a part of this field with people all over the world that deeply care about the health and well being of children. And super grateful to know you, Lisa, and grateful for all the mentoring and help that you've been to me, and thank you for talking about families with Dr. Sassy.
I love it. I love it. Well, Stacy,
We're all going to be all right.
thank you for embodying authenticity and for
Thank you.
following your own heart and following your own rhythm and clearly some magical things have happened as a result of that, which I think is that's just the permission I'm hearing also
Mhm.
for myself and for listeners today is let's get in the playroom and be ourselves and
Mhm.
follow our own intuition and yeah, maybe we keep the families a little bit more on the radar.
Yeah.
So, having said that, listeners, thank you so much for spending time with myself and Dr. Sassy. I'm gonna need a name. I'm gonna need a new name, Stacy. Right?
Ah.
Lisa, and Dr. Sassy. I gotta have them. Mrs. Joe Bon Jovi.
Dr. Hottie. There it is.
Dr. Jovi. Okay. Dr. Bon Jovi. Just kidding. Anyway, listeners, you know where to find Stacy. If you haven't, I mentioned this at the beginning, go back and listen to the episode where Stacy was a past guest to hear more about 30-day blackout. And wherever you are in this world, whatever you happen to be doing right now, even in this moment, take a breath, connect with the little one inside of you. And my call to action to you is to get curious about what the little one inside of you would love to go do and let the little one get creative and play in some way and take care of the little one because not only are you but the little one inside of you also, so the many of you together are the most important tool in the playroom, most important toy, most important tool in the playroom. So until next time, everyone. Thanks, Stacy.